honor to introduce Dr. Muller, from whom I have had the opportunity to learn before, and this morning as well, but way before. And you're in for a treat, and I would like to tell you a little bit about Dr. Muller. Robert T. Muller, PhD, trained at Harvard, was on faculty at the University of Massachusetts, and is currently at York University in Toronto. Dr. Muller is a fellow of the International Society for the Study of Trauma and Dissociation, ISSTD. For his work on trauma treatment. His newest therapy book, Trauma and the Struggle to Open Up, was awarded the 2019 ISSTD Award for the year's best written work on trauma. So I recommend you go and look for that one in Amazon. And his award-winning bestseller, Trauma and Avoidant Client, has been translated widely as lead investigation on several multi-site programs to treat interpersonal trauma. Dr. Muller has lectured internationally, Australia, UK, Europe, USA, and has been keynote speaker at mental health conferences in New Zealand and Canada. He founded an online magazine, The Trauma and Mental Health Report, that is now visited by over 100,000 readers a year. With over 30 years in the field, he practices in Toronto. Thank you, Dr. Muller.
Thank you so much. Does anybody need a handout here? Let me grab one.
Sorry, is it handout or handout?
There you go. Does anybody else need? Yeah. There's a few here. You can feel free to pass them out. There's a few there. Okay. Welcome, everybody. Did you get a copy? Okay. Good. All right. Good. So, topic is forgiveness, a double-edged sword of trauma therapy. So we will be talking about different aspects of forgiveness and sort of through a critical lens. Much of the work that I'll be talking about is from my book, Trauma and the Struggle to Open Up, so you can find many of the things we talked about there. Okay, so when we say a double-edged sword, there's a theme that derives from that clearly, and what I'm putting forward here is that in trauma therapy, the wish to forgive does sound compelling, and it can be a relief to some. So, of course, there are those who have been through trauma who find that reaching a place of forgiveness of some kind is helpful to them. However, it can also be a burden to others. The idea of forgiveness can be a burden. And so I do contend that in trauma work, as a therapist, the concept of forgiveness is, in fact, a double-edged sword. Before I start talking about what I mean by that and specifics, let's take a look at a case. And this particular case is the case of Michelle Alexander. Michelle Alexander is an African-American woman, a lawyer, professor, who also writes for the New York Times. So she wrote a piece in 2019 called "My Rapist Apologized." And we're going to read a little bit about that. From that, I'll read a couple of sections from it, some excerpts, and it'll give us an opportunity to maybe play with this idea of forgiveness. So she writes, I did not call my mother after I was raped, but I called her immediately after I learned that I had gotten pregnant as a result. It was my first semester of law school, and I was terrified that everything I had hoped for my future was suddenly unraveling before my eyes. At the time, my father was unemployed. My mother was working a minimum wage job, and miraculously, I was at Stanford Law School with a chance to pursue my dream of becoming a civil rights lawyer. But now, everything was falling apart. She writes, I was devastated, emotionally wrecked, not only because I had been raped, but because I was pregnant with my rapist's child. I wondered out loud whether I should just quit law school and give birth to the baby that had been forced inside me. My mother listened quietly. She then told me that she too had been raped at about my age. She was raped by her boss when she was 20 years old. It was her first sexual experience. As my mother choked back tears, she said she never wanted her own daughter to experience the same fate. I found it difficult to face what had occurred. Like countless women, I found a way to blame myself. Why did I drunk dial him at midnight? Why did I say he could come to my dorm room at that hour? Why didn't I scream? He wasn't a big man. He was rather skinny, muscular, but lean. Couldn't I have fought him off? I did say no over and over, she writes, and tried to stop him, but his hand slipped over my mouth to silence me, and his forearm pressed down across my shoulder to pin me to the mattress. I didn't call the police, not after he left my dorm room and not after I discovered I was pregnant. I never once imagined that calling the police could help my situation. It could only make things worse. I envisioned prosecutors, courtrooms, interrogations. Now, my own situation proved highly unusual in one respect. The man who raped me admitted what he had done and apologized. My rapist called the day after he violated me and left an awkward message on my answering machine saying he was sorry about what happened. He did not use the word rape. He asked me to call him back. I did not. More messages were left in the days that followed. Each time he sounded more distraught, more apologetic, more despondent. On the day I learned that I was pregnant, I finally decided to call. I wanted to punish him with the news. Look what you've done to me. I wanted him to know that his actions had consequences, and this was something we'd both have to live with for the rest of our lives, no matter what I decided. Well, when he answered the phone, he sounded relieved that I had finally called. I interrupted his efforts to apologize yet again to deliver my news that she was pregnant. After a long silence, he asked quietly, "Are you sure it's mine?" I nearly threw the phone against the wall, but instead steadied myself and told him coldly, "Yes, you did this to me." "Oh no," he sighed, a long pause. "Are you going to keep it? It's your choice, totally up to you." "I know it's my choice," I replied. An even longer pause followed. The silence stretched between us, and I refused to be the one to break it. Then he said slowly, "I know you don't believe me, but I am sorry. I didn't give you a choice. I will never forgive myself for what I did." Okay, I hope this story raises a little bit of different kinds of emotions, different kinds of ways that folks can think about it. But let me ask you to, what are some of your thoughts as you hear my discussion of that? Anything that comes to you? Yes.
I heard in California there was a lot of incidents of people suing their neighbor because they didn't apologize when the dog bit them. So they made a law in California that you can't use it in court, that a person comes and says they're sorry that the dog my dog attacked me. But they found that when people just felt like they were apologized to, it cut down the court cases. That's really what propelled people to take their neighbor or whoever it was to court, because they felt like they were being they weren't owning up to that. They were owing an
Well, it's interesting. We'll think about the issue of the apology in a bit, and we can sort of think about kind of what makes a good apology. What is an apology from a psychological standpoint? But as you hear the story, first of all, what emotions come up for you? What thoughts do you have? I think you had your hand up. Yeah.
So just the idea of sometimes with an apology, it's too little, too late.
Right.
Like how helpful is
Mhm.
the apology to her right now? But
Mhm.
doesn't change the circumstance. So what is she supposed to do with that?
Mhm.
And it's thrusting that burden off of her for
Mhm.
something that she never asked for in the first place.
Mhm.
Really
Right.
complicated.
Right. Exactly. Okay. Good. Yes, you had your hand up.
Yeah, so firstly, I noticed more like a somatic reaction,
Okay.
and I'm noticing...
Can you share is it okay if I ask you to share what your somatic reaction was? Yeah.
Feeling nauseous and queasy.
Okay. And at what point in the story did you find yourself feeling that?
So I'm going to tell you the thought that I'm having, and then I'll tell you that's when
Okay.
when I was recognizing that my clients are not that lucky to have somebody reaching out to them that wants to
Okay.
apologize. The world that I live in is a world of with the abusers, the perpetrators are typically the parent of the of my client, and they're not, or whatever the case might be, step parent, but caregiver, and they're not even owning that they did something. There's no conversation. No one's running after.
Mhm.
So,
Mhm.
and I apologize for saying this, but I'm like, my clients are not that lucky. So
Mhm.
I'm hearing it from a place of, wow, what a gift she has.
Mhm.
And then maybe that feels very foreign to a lot of people, and I apologize, but there's a world of people out there that are not getting this, and it's a much longer conversation. But so I'm like, I'm just living
Mhm.
that
Mhm.
reaction of like,
Okay.
not everyone gets that.
No, I mean, I think it's. I'm hoping that there is a diversity of feelings and reactions, and so that's really interesting. Yeah, very interesting. Yeah.
Like this expression that there's like a gift that keeps on giving, so this is like the trauma
Mm.
keeps on giving.
Mhm.
It's never, I don't know if she decided to keep the child or not, but it's not only something that happened once, she has to live with this.
Mhm.
And each stage of life, whether he's going to step up and be a father, if they're not together, or whether
Mhm.
she's going to raise the baby on her own, whether it's something that
Mhm.
will go way into the future.
Something she's going to wrestle with for the rest of her life.
I
Right.
have a
Yeah.
client who was very neglected and abused by her mother,
Mhm.
and then she keeps trying to make a rapprochement with the mother,
Right.
and the mother keeps saying, "It was in the past, leave me alone."
Right.
And she compulsively, like we're working on it, she compulsively keeps trying to get the mother to understand what that was like for her, and the mother just doesn't want to hear it.
Okay.
Yeah.
Good. Okay. Great. Yes.
So I had a lot of different feelings at
Yeah.
different points. I felt thrilled that she was able to express the story in such a public way.
Mhm.
A lot of confusion when the mom shared her own experience. Like, was that the time to tell that story?
Mm.
And how validating could that be?
Mm. Mhm.
And like just a lot of confusion in there about, what is trying to be achieved there.
Mhm.
It felt empowering that she was able to write the story, empowering in that she was able to not call her
Mm. Mhm.
and to actually create that distance and that to have him sit with, the idea of apology, or that you could even apologize for such a thing. That is
Mhm.
like,
Mhm.
no, you had your hand over my mouth and your arm against my shoulders,
Mhm.
holding me down, and you think that deserves an apology?
Mhm.
Like,
Mhm.
owning and apologizing are two different things
Right.
in my book. I felt like there was so much regulation on her side in the sense that she was actually able to think through so many parts, and I don't know how long it took her to get there. And it was really
Mhm.
like for her to say, I'm going to call him and show him what he did to me. I'm very curious about the support system and what she went through to get to that place. So there's just, like I said,
Yeah.
there was
A lot of questions, yeah. No, that's great. That's great how you're sort of framing the myriad questions that can come up as a result of a story like this, and that's why I wanted to sort of lead with last comment, and then let's unpack. Yeah, no, please, yeah, go ahead.
I was actually sort of reflecting on the way his apology robbed her of her opportunity
To yeah,
to have her own process.
yeah, right,
Didn't get a chance to be angry, to kind of throw herself in.
yeah.
Her opportunity.
Yeah. Okay, so it's okay. Great initial thinking about this, and as you pointed out, the story raises kind of more questions than it answers. Some of them, what is the place of forgiveness of the perpetrator in trauma recovery? I mean, is that part of trauma work, in fact, even? When is forgiveness helpful? How can we help clients navigate forgiveness? And how does an apology fit in, if at all? So these are some things. So let's start with the issue of the apology, and I will say that the problem with, or one problem with apologies is that they are in fact often very confusing and can lead to confusing feelings in the client. A sense of, perhaps in some people, a sense of relief, and perhaps in others, a sense of indignance. Like, how dare you think that an apology would solve this? So it has different effects on different people. And has the perpetrator actually even apologized? What is a good apology? And in fact, there's some interesting stuff written about this, particularly in legal writings. So law professors have written about this more so than psychologists, actually. And it turns out that all apologies are not created equal. There is such a thing as a better apology. Now, that may or may not mean that the person who has been transgressed against is obligated or not obligated to respond in a particular way. But there are apologies that have a greater likelihood of hitting the mark versus those that can easily miss the mark. Richard Wiseman, who is a professor at Osgood Hall Law School, that's the law school at the university where I teach, York University in Toronto, has written a book called Showing Remorse. Thank you so much. A book called Showing Remorse. And in it, he analyzes different legal, so he's a law professor, and he analyzes different legal cases where there was some sort of transgression, and what apologies looked like, what they didn't look like, how do jurors respond to apologies. And he looked at Timothy McVeigh and the Oklahoma City bombing and his stoic reaction, which led many of the jurors to feel that, members of the jury, to feel that he clearly didn't care. And you might think, okay, so people in court expressing remorse really need to show that they care. But that's not necessarily true either, because it also turns out that sometimes when there are lots of tears and when there's lots of distress, it may be seen as a manipulation. So it's extremely challenging to assess what appears like an authentic apology. But what he does say is that when members of the jury feel that when they judge that there's an authentic expression of remorse, whatever that means to them, and it can mean different things to different people, but people want an authentic expression of remorse. I found that really compelling, and I think that that's also true for clients. Wiseman also talks about the combination of an authentic expression of remorse and taking responsibility. Now, Wiseman is not a therapist, and he's not writing for therapists. I simply read this and thought, this is really relevant and interesting to this issue of apologies. And so I applied it to a case that I saw, and so this is in Trauma and the Struggle to Open Up. And this is the case of the dentist. So let's take a look at this issue in the case of the dentist. This is page 105 in Trauma and the Struggle to Open Up. The section called All Apologies Are Not Created Equal. So this is me writing now. One couple I worked with came for counseling following an affair the husband had had with one of his associates. Despite all that had happened, both husband and wife said they wanted to work things out between them. As I often do with couples, I hold individual meetings with each to better understand their early personal histories. But I don't form any illicit pacts, keeping secrets with one member of the couple from the other, and I told them so. In his individual session, the husband confessed the affair had lasted years longer than he had admitted to before. He had a large dental practice, and he had pretended over the years to go on many conferences with his associate, but was actually spending days away with her. The secrecy of the affair and his dishonesty were feeling unbearable to him. I encouraged him to come clean. If he wanted to do couples work, his wife would have to know the truth. So he told her later that day. In the next session, a meeting with the two of them, the wife was still in disbelief from the news. You see? I can't believe a word that comes out that passes through his lips. Turning to him, she says, "Aren't you sorry at all?" He took a deep breath, leaned forward, and looking her squarely in the eyes, replied with, "I'm sorry you were lied to." To which she marched straight out of my office and slammed the door behind her. To his utter shock, the apology had failed. The following week, I was astonished to see them back in my office. I had figured they were gone forever. And as we unpacked, "I'm sorry you were lied to." An apology so limp as to render itself lifeless. I wondered out loud about his use of the passive voice, "You were lied to." Using language that was cut off personal connection to his own actions, he was being evasive, shirking personal responsibility, keeping feelings of remorse far away. It was an effortless, painless, self-protective apology. In his inability to show vulnerability, for remorse requires great vulnerability, he was only digging himself deeper. Okay, let's look at that and let's think about what was the problem with the dentist's apology. Why did the apology fail? How do we understand this? What does this tell us? Any thoughts? Yes?
Why did they came back the following week?
They did come back.
Why did they say they came back?
So that's a great, so that would be a question you would want to ask, right? Like, what's going on here that they were willing to come back, right?
Well, my thought was, as you're describing
Mhm.
it, was even that apology that he gave might have had some authenticity to it from him.
Okay.
Or in their relationship,
Okay.
where she might have accepted some of it, even though she stormed out and slammed the door. Later on, she might have thought about it more,
Mm-hmm.
and maybe it affected her. At least they came back to your office.
So it's a really good question, because different people's reactions to apologies are different. So, good. Let's put a pin in that. Other other thoughts. Yeah. Somebody who hasn't spoken yet. Yes.
I agree in terms of the passivity of it. It also didn't hit, of course, to the core of the cheating. It was, I'm sorry you were lied to versus I take responsibility
Right.
for what I have done and what that was that he did.
Mm-hmm.
That he cheated.
Good.
For much longer than she had even known.
Than he had admitted to. Yeah. Good. Very good. Yeah. Mm-hmm.
She also don't know what he told her at the house before
Right.
he came into session, but
That's true.
in my experience, most men don't know how to be empathic, and there was no empathy there. It was just, it was also in the second person,
Right.
where he's not taking responsibility. It's
Right.
just like, well, you just didn't get what you needed, so.
Right. Right. Okay. Right. So, and that would be Richard Weissman would say that was a poor example of showing remorse and taking responsibility, based on the kind of things he wrote about when he wrote about that. Yeah. And you might actually hear that as sorry, not sorry, right? Okay. Yes.
I don't think she really was able to take the whole thing in. She was still in denial,
Mm-hmm.
thinking that maybe perhaps this could be fixed. I don't think
Mm-hmm.
it wasn't helpful, that thin apology to help her really get to the place where she really understood the depth of the betrayal.
Right. Okay. Yeah, and betrayal is an important in trauma. Betrayal trauma is one of the toughest to treat. When people feel that they have been betrayed, there's a sense of, often a feeling of despair about the world. Like what kind of world is this that we live in, where someone who I trusted so much could hurt me so badly? Sometimes it leads to existential questions. Is there even any reason to think that anybody, or that there's any purpose? Or, yeah, betrayal trauma is tough. It really cuts at some really powerful internal experiences. Yes, last comment, and then we'll.
I don't, the way I receive it is
Yeah.
that he had no way to express, because he had talked to you about how this was like driving him crazy about how awful he felt, and that he didn't have the skills to, like, there's no relationality here, and that's maybe one of the reasons he had the affair in the first place.
Right.
Is that there's that missing piece of connection, of understanding each other and being able to express to
Right.
each other. She
Right.
had one expectation, and he hasn't been able to meet that, and she hasn't been able to express it in a way that they can come together.
So it raises a really interesting question. That's a great comment. Is this somebody who doesn't have the capacity for remorse? Or is it just that he doesn't know how to show remorse? And again, like Richard Weissman, when he was writing, he was talking about what people accused of crimes show, because that's what we're talking about when we're talking about juries. That's what do they see and what does the person show. He wasn't talking about psychotherapy. Applying this to psychotherapy, going a little bit deeper, there's what the person shows and there's what the person's actually feeling, and is there an authenticity to this expression of remorse? Okay, so all right, how do we work with this? Well, first of all, it's really important in therapy to help the client unpack their personal reactions to apologies. It's really interesting in this room to hear different people's reactions, both to apologies and to the concept of forgiveness. Each of the stories that you read about led to some pretty some diversity in responses and in feelings and in perspective. And I think that that's really instructive. There is no right way to respond to these. There is, though, a mix of different kinds of responses. And working with clients, what I really discourage is working from an ideological perspective. And I will really make that clear around the issue of forgiveness in a moment, because forgiveness, more than anything in psychotherapy, is put up as a virtue. And I'm going to really work here today to discourage that way of thinking about it and to shift towards thinking of forgiveness like any other human experience, any other affect, any other set of ideas, any other experience, and to think of it more like we do in all psychotherapy. We work with process. And so same thing around apology. Help like really looking at the client's subjective reaction. What does this client experience here? Some clients may feel disappointment as a result of an apology, even if you have a sense of, well, wait a minute, this apology is a positive ending. Shouldn't we be at least a little bit appreciative of it? I mean, and kind of, I guess what I'm saying here is really work with your countertransference. Is this about me or is this the client? The client may, on the opposite end of the spectrum, feel a sense of relief by an apology, and you may feel the sense of, what? No, I'm sorry, but that, what he said was not good enough. You might feel that internally. And that may be, again, part of your countertransference. And it might be fine for you in your relationships to feel a sense of indignance and like, no, unacceptable. You don't do X, Y, Z and then just go apologizing for it. You may feel that way. However, the countertransference challenge is not imposing your contempt for the perpetrator onto the client, because the client might have mixed feelings toward the perpetrator. So it's really complicated, and I'm really sort of just putting out there around apology to think about this idea of subjective, working with the subjective, as we do in every other way with clients. I think with apology and forgiveness, the reason this hasn't happened so much, the reason there's so much psychotherapy literature that makes forgiveness a virtue. And I think it comes out of a tradition. I think it's primarily kind of a Christian kind of values tradition. I think it comes, but I don't have much evidence for that. But I think this idea of forgiving the person who has harmed you is really seen as a virtue. And I think it's permeated our culture. I think in many subgroups we see that. That's my contention. And so I think that it's a tough one. And so very often, when you see writers, psychotherapy writers, very often they're influenced by that idea of forgiveness as a virtue. So I promise I'll take questions soon, but I want to sort of work toward something here. And that is, let's start really thinking about forgiveness and what the problem with it is. So I'm going to start with being a little bit critical of it. And that is that the biggest criticism I have in trauma work, and I'm not against forgiveness, I'm not the anti-forgiveness guy. I'm very supportive of it when it comes from a place of authenticity, when we work with our clients, when it makes sense for them psychologically, and when it's what they really need. And so it's fine. What I'm going to point out here is that where it gets people into trouble is around this idea of pressured forgiveness. In the interest of time, we're not going to look at the case of Victor because there's a lot of stuff to talk about, but I will say, where does pressured forgiveness come from? Well, there are a couple different elements. One is the blood is thicker than water idea. You know, honestly, you really should be forgiving your sister for XYZ. Blood is thicker than water. Why are you being so pig-headed about this and not allowing your sister? Cut her some slack. It's not her fault, that XYZ, or this other family relation. There's also societal pressure around forgiveness. The idea of what does the right kind of victim look like? So let me ask you for some examples. What does the perfect victim look like if you are going to think about this issue? When people, the victim that people will have sympathy toward, the victim who, what?
Powerless.
Yeah, what's that?
Powerless.
Powerless, yeah, go ahead.
A white heterosexual Christian male.
Okay, interesting. Any other thoughts? Mm-hmm.
The Charlie Kirk murder, the wife 2 days later forgives the killer of her own husband.
Mm-hmm.
Without any, it didn't seem like I'm sure she was sad about it, but I think she did it from a religious perspective.
So perfect victim being someone who understands and forgives and doesn't hold a grudge. Maybe that's from some perspectives. I think I'm sensing some awkwardness here, and I hope there is, because it's a hard question to answer. It's an impossible question, really, to answer. It's a question that has no answer.
I think it's an oxymoron.
Okay.
Perfect victim.
Okay.
Like,
Right? But it is something that in court cases is a real thing. It's a real thing. So I wrote an article with a colleague who's a law professor at University of British Columbia, and it's called A Trauma-Informed Approach to Evidence-Based Law. And we analyzed, I was doing the psychological piece of the article and he was doing the legal work. And it was published in the Canadian Bar Review, which is our main law journal in Canada, or one of the big law journals. And it was really looking at this question of what do people look for when you have when you have victims of trauma, of some sort of trauma. What do people look for in the trial? And it turns out that it's a mess. It's really a mess. And you have judges who will judge women as liars if they cry too much. And then other judges who will judge women as liars if they cry too little. And then if there's inconsistency in their testimony, so if you have somebody who has been through some kind of trauma and they're asked questions about the rapist, let's say, or the person who abused them in a domestic situation, and well, what color shoes were they wearing that day? And the person says red. But it turns out the evidence shows they were wearing purple shoes that day. So is this person a liar? Well, if there's inconsistency in facts, then yes, then greater levels of inconsistency, judges are instructed to consider this person to be an unreliable witness. And remember, when you're a witness, if you're a victim of a crime, according to, in common law, you are seen as a witness. You're not, there as the victim. You're there on the witness stand because the person who has perpetrated this criminal act has perpetrated against the state, or in our case in Canada, has perpetrated against the head of state, which is, I guess, King Charles. But anyway, yeah, that's right. So that's what you're a witness to a crime. And so are you a reliable witness? If your facts are a little bit confused, but I mean, tell me, if you're someone who's a victim of a domestic situation, do you remember if there were red shoes or purple shoes or whatnot? So it's very easy, very, very easy to poke holes in testimony. And so you get these people who become the imperfect victim, the kind of victim who is then judged by others as being liars. And so it's incredibly challenging, the pressures to not go to trial and to just forgive and forget. The societal pressures are huge on many, many victims of intrafamilial abuse. There was a question at the back. Yes, Joe?
Is there also a need for the victim to be pure? Like if the victim
Right.
acted in a way that we disagree
Exactly.
or showed some level of ambivalence about what was happening. that
Exactly.
they're not purely victim.
Exactly. We see in Michelle Alexander's case, she says, why did I drunk dial him at midnight? So the implication, and it's a great example of someone who says, well, I wasn't pure, if you're using that kind of idea, kind of morally, whatever that means. I did this, and so therefore, what do you think about that? And yeah, that's right. So very often people will look at that and then judge the victim as being the wrong kind of victim. So there's this unbelievable pressure on many victims of whether it's sexual assault or domestic abuse or abuse or child abuse to forgive because of all of these things that they're up against. It's a big challenge for them. Yes.
Knowing what you're just saying now, I'm thinking about it. This might
Yeah.
sound ego-centered. I don't accept, let's say if a guy abuses a child, and the child grows up, and the guy wants to do something about it, the situation.
Mm-hmm.
In my mind, let's say the guy apologizes to the child, now grown up.
Mm-hmm.
I think, this is me now,
Mm-hmm.
that's not enough. Even if the child accepts it.
Mm-hmm. Mm-hmm.
I say a sentence, an apology, or two sentences did something extremely destructive. Even though she accepts it, I say, no, you got to do more than that. So sometimes I actually have the guy pay for the therapy or do something of an action over a period of time that it meets my, again, it sounds like it's ego-centered, because I don't think the person, they might, like you say, accept an apology very quickly. They're hungry for it, but the apology is insincere, or it's very shallow.
Right.
Or it's anybody can say, forget, I just shot your kid, so I'm sorry.
So you're not alone in that contention. And actually my colleague who wrote that article with me, the article Toward a Trauma-Informed Approach to Evidence-Based Law, to Evidence Law, sorry. He has a book in which he really unpacks the whole issue of restorative justice. And the example you're giving is one potential act of restorative justice, that sort of thing, kind of actual actions where the rubber hits the road doing something. Okay, but so how does this relate to psychotherapy, okay? I'm just going to take a look here. Let me just say a couple things here. So, pressured forgiveness is a problem in... I'll get to the question in a second. I just want to make sure that we have enough time to sort of get to... How are we doing for time? Where does this go till? Until 3:50? Oh, okay, we have an hour. Okay. So, why do we care about this issue of pressured forgiveness in therapy? So, and I'm going to sort of... encourage us to shift from thinking about so much philosophically what's right and wrong, although that's a fine exercise, whether it's philosophically, religiously, morally. I think those are great exercises legally to think about. But for the purposes here, how does this relate to therapy? What does this actually mean for clients that you're working with? And the first thing here that I want to say, so that idea of like, well, who cares if there's pressured forgiveness? Why is this a big deal? Well, there are two real kind of concerns I have when clients that we work with become affected by this idea of pressured forgiveness, whether it's through family or through friends or just a social pressure or through their church or some other group or synagogue or whatnot. If they feel this pressure to have to forgive a certain subgroup of people, forgive a person. Well, first of all, my biggest concern is that pressured forgiveness leapfrogs over the actual therapy process, the psychotherapy process. When Judith Herman in 1993 wrote Trauma and Recovery, one of her biggest insights, one of the insights that I think sometimes gets lost when we start doing very technique-y kind of psychotherapy for trauma, is that a big part of the therapeutic work is mourning a loss. And the losses are very important. In this case with Michelle Alexander, regardless of whether she chooses to forgive, doesn't forgive, has an abortion, keeps the child, I mean, we don't know the end of that story, right? She knows the end of the story, but we don't actually know from this little piece the end of the story. Regardless, what are some things she had to mourn? Like what did she have to mourn? Yes. The loss of choice. What else? What's that? Loss of innocence. Exactly. Here she was, a 21-year-old young woman in her first year of law school, sort of excited to be a civil rights lawyer, and this happens, and major loss of innocence. All of a sudden, there's a sense of the world as being a lot uglier than she once thought. That's a huge loss. Anything else that... Sorry? Dignity, loss of a sense of dignity, like, wait, this is, somebody's imposed themselves on me, I no longer have a sense of self-determination, yeah? Loss of identity. Virginity, loss of virginity, that's right. I was going to say loss of identity, but yes, absolutely. Yeah, no, and I work with a number of clients who've expressed that, and it is a big deal. It's a big deal if it's a big deal to the client. And it's tied up in feelings about worthiness, it's tied up in their feelings about their relationship with their religion, with God, with lots of very, very important things. Who am I now? Am I valuable still as a partner and as in the role that I want to have in my life? Absolutely. So there's a lot of loss here. Where am I? Here I am. Okay. So Judith Herman's insights around mourning are really, really important, and I strongly recommend that folks take a look at Trauma and Recovery. I'm going to read you something that shares a little bit about myself, actually. It's in the very beginning of Trauma and the Struggle to Open Up. And so the idea of some of the mourning that has to happen in trauma work. It's on page 2 of Trauma and the Struggle to Open Up. I get asked a lot, this is me writing, how did I develop an interest in trauma? I used to have a ready answer, one focusing on the intellectual side of me, my interest in research and clients and so on. All true, perhaps, in part, but a more honest answer was something I appreciated only in my early 40s. My interest in trauma stemmed from my past, from my family's history. My parents were school-aged children during the Holocaust. They grew up in Budapest, Hungary. As Jews, their lives were, at the time, in constant danger, and they survived only because of a combination of luck and the goodwill of a few non-Jewish family members who took great personal risk to help them. As a young child, my mother was separated from her family, given false papers, and put into hiding with near strangers. It was a sensible strategy under the circumstances. But she was only 7 years old, and it was a huge, huge burden for her throughout her life. With no family around for long stretches, my mother came terrifyingly close to having her identity revealed. Some adults were keen to betray her as Jewish. It was only a fluke that she survived it all. As for my father, his father was killed. He was murdered. And after the war was over, my father, still a boy, learned a trade and went to work. He had to help support his family. My father became an upholsterer. In my own consciousness, shaped by the stories told in my family, the legacy of the Holocaust was the loss of childhood. It's hard for me to imagine the terror my parents felt as children, terror so many others felt as well. The stories occupy a large space in my mind. Families cope with trauma in different ways. Many share stories about the past, but many cope through silence, protecting themselves and loved ones from the truth, because, after all, the truth can be unspeakable. Okay, so I share that as kind of my own experience with the idea of loss. I mean, personally, I will say I grew up in many ways with parents who didn't really know how to be kids. They didn't really appreciate the innocence that childhood should have. Of course, they were also Hungarian immigrants trying to manage in Canada, and it was, they were not culturally tuned in and that sort of thing as well. But the biggest thing was not that, because most of those stories are cute and funny. The really painful part is much more about them not really being able to understand childhood as they lost their childhoods at a very young age. And so mourning that loss, and my mother has actually, like when I went into psychology, I went into therapy, and then like 6 months later she said, I'm going to do therapy too, which is, if my mother, that was just like super weird for her, super weird. But she did, and to her credit, came to understand some things about the losses she'd experienced. Okay, so what is there to mourn? There are many different things to mourn. We have a few examples here. I just wanted to share mine as a kind of a way of orienting. And I think we all have something to mourn, and we all get attracted to trauma work. Probably there's something in us that draws us to it, and I'm not going to say necessarily what it is, but we all have something that we need to mourn. In some cases, a changed worldview. The question of why me? And so when we talk about these kinds of questions, like I mentioned in my last presentation this morning, if you're doing good trauma work, if you're doing good work around mourning and loss, existential questions should come up. Existential questions don't have answers. And for some people, religious answers work well for some people. For others, not so well. And that's okay. Different people will need to grapple with their existential questions in different ways. The issue is not about the answer. The issue is really about asking the question. And so, why me? Of all the people that my grandfather could have molested, he had 9 grandchildren, why did he pick me? Is there something, do I have the word sucker plastered across my forehead? Why me? Or another question, why not me? Why did my sister have to go through it? I don't understand. She was so little, and she went through this, and my grandfather did nothing I don't understand. Why not me? What did I do? And sort of living with a sense of survivor guilt. And these questions don't have answers, ultimately, but in the process of asking them, and in the process of the therapist simply being curious and giving space for them to be asked, with curiosity, without judgment, the work of mourning is where the heart of trauma work lies, I think. And my concern about pressured forgiveness is that it just leapfrogs right over that. The example that you give is a very good one. Something terrible happens to a loved one, and then 2 days later, boom, I forgive. It's unimaginable to me that such a person I feel sad for, because they've really lost the opportunity to really think deeply about what happened to them and what the meaning is in their lives. And my worry is that it's going to come back, as Freud said, the return of the repressed, that it's just going to come back to bite them later. Okay, so before I move on to the next big concern I have with pressured forgiveness, yes, question, thoughts?
I'm actually just worried about what another participant said before, which also relates to forgiving the perpetrator, that with allowing a perpetrator to pay for therapy, that could be one of the pressures in forgiveness. I guess you could call it a double-edged sword.
Right.
But allowing that to be the form of amend, I guess you could call it.
Amends, yeah.
Would be, I think, would set pressures. Like, so I've paid for 15 sessions now, or I've paid for 30 sessions now. When are you going to forgive me? Or even other people maybe say, he already has paid, or she already has paid for 30 sessions. How long are you going to, what is this? And then maybe calling the therapist, or all those things that can happen. At the same time, I do see the value, but as I said, double-edged sword.
Double-edged sword, absolutely. And so this is where, and that's actually come up in discussions. I don't know how much you know about Canada's Indigenous population. I won't go into great detail, but I'll just say that Canada 100 years ago did horrible things to our Indigenous folks, and we only have started dealing with it about 15 years ago, so in very limited ways. And so the question of restitution, restorative justice, is one that's being discussed a lot in Canada. But yeah, I mean, like, and with each sort of action, is this just buying forgiveness? Is it not? But then again, how do you actually show it through action that you're in fact apologizing? So yeah, it's a tough one. Okay, let me move forward just to make sure I have enough time here. Another point I want to make about the problem with pressured forgiveness is that very often what it can do is it can have the impact of undermining anger and indignance. And anger and indignance are really important emotions. Yes, they've gotten a bad rap sometimes, when people talk about anger, anger management and all of that. And I've got no problem with helping people be able to self-regulate and deal with their anger so that they don't hurt others. I got no problem with that. But what sometimes can happen is that it can be part of a cultural value which devalues, which says, don't be so angry. A lot of, honestly, there's been a lot written about this. A lot of black women have written about how, when they get upset, they're labeled as an angry black woman, and other people as well. So this idea of anger is an interesting one, and it can be a moral response to injustice, and it can also be a vehicle for change, whether we're dealing with corrupt systems or something else. And in therapy, what does this look like? Well, in therapy, this means that with those clients who struggle with anger expression, those clients who, and I get this a lot with many trauma clients, who say to me things like, Dr. Muller, I just don't understand. I'm hearing about all these things about Syrian refugees and people, and then what happened in this part of the world and what happened in that part of the world. And those are the people who've really suffered. So my uncle molested me, shouldn't I just get over it? Why am I making such a big deal? I mean, I grew up in a nice house and I had food and am I wasting your time? Right, that kind of thing. And so with clients like that, it's a real kind of challenge, because you might feel like, no, Kelly, you're not wasting my time. What you went through is really a big deal. And I may feel that, and I may express that, I may not, I don't know. But the question of your countertransference can be really triggered there, where you want the person, you can feel the anger that the client can't bear feeling. And so it's a challenge how to work with them so that they find that part of themselves that holds the anger that right now is exiled in Richard Schwartz's work in IFS, kind of a feeling that is exiled and split off from consciousness, rather than you feeling it for them and telling them they should feel this, helping them find different aspects of themselves so that they can find that part of them that does in fact feel, no, this wasn't okay. No, what happened to me was wrong. This is important for those clients who have trouble with anger expression, who are, those clients who are compulsive caregivers. Oh yeah, no, yeah, I've had it tough, but you know what? I manage other people and I take care of them and I'm good to go. Those kind of individuals, sometimes compulsive care, John Bowlby talked about that. People who have trouble being able to be vulnerable and to find and express those vulnerable feelings because they've been exiled, they've been split off, and it's hard for them. So part of the work there is helping them find those aspects of themselves. Not you telling them, but giving space for it to be naturally found through the work. Very often those feelings are held in ambivalence. So the person may have cut it off, but what I talk about in my first book, Trauma and the Avoidant Client, is that cutoff is never 100%. Cutoff is porous. And so they may be defensive and cut off certain feelings, but those feelings poke through at times, and listening and noticing them and giving them space for expression is part of the work, so that then the client can find these parts of themselves and be able to mourn the losses that up to now they haven't been able to be able to say, yeah, reach a point where they can say, yeah, I am really angry about what happened, or I'm really upset about what happened, or this is not right, and to be able to mourn that loss. Does that eventually lead to forgiveness? Maybe, I don't know. But the mourning piece is the piece that has to happen. And what's the clinical problem with pressured forgiveness? It undermines safety. What might happen is you might have a client who returns to a dangerous situation without really having had a chance to unpack their feelings. It may undermine their sense of self. We talk about gaslighting in trauma, that the person feels a certain feeling, but is told not to feel that, and that can be a little bit crazy-making for clients. Forgiveness, precipitous forgiveness, or pressured forgiveness, can be used as a way of avoiding painful feelings. So it can actually be used as a defense mechanism. And again, that's where it's a problem, because the person hasn't really found expression for these feelings that are there. Forgiveness can be used to avoid feelings of sadness, anger I mentioned before, hurt. And at the end of the day, it doesn't ultimately bring a sense of relief. So what do we do? What we do is we've help the client reframe forgiveness as a psychological process. This is not actually hard to do. It's actually not that hard to do. It's really something that is hardest if you adhere very strongly to the idea that forgiveness is a virtue. If that to you is extremely close to your heart, that forgiveness is next to godliness and that sort of idea, what I'm asking you to do here, will be more difficult. If that's not something you adhere to that closely, if you're open to the idea that forgiveness is a part of the natural human experience, just like anything else, whether it's shame, whether it's guilt, whether it's sadness, whether it's conflict, interpersonal conflict, whether it's love, whether it's hate. Just one part of human experience, no better or worse or more important than anything else. It's just that. If you can sort of view it that way, then you can much more easily help clients with the struggle. Because then you can ask all kinds of questions that you would ask about anything else. The client says, I feel ashamed about such and such. You'd say, oh, tell me about it. When do you feel ashamed? The client says, I'm feeling so betrayed by my family. Tell me about your family. What's going on? Like you would ask this about anything else that would come up, you would ask it. Forgiveness is no different. It's not a forgive, don't forgive kind of scenario. When you talk about, do I forgive them? Well, I forgive them. No, I don't forgive them. When people use that language, that kind of black and white language, it derives from the idea of forgiveness as a virtue. I'm not ready yet to forgive. That idea, I'm not ready yet to forgive. I haven't reached that high spot that's so up there, but one day maybe I will. Again, that views forgiveness as a virtue. If you can sort of shift away from that and think of it as a process, then it can allow for all kinds of questions. It can come and go with ups and downs. The client says, my sister says, I'm such a jerk for not forgiving Grandpa. I don't understand, but she says I'm a jerk. Do you think I'm a jerk, Dr. Muller? And so then I might explore, tell me a little bit about that. Well, because shouldn't I forgive him? I mean, he's a good man. He's a lawyer in the community. He's a good guy. And, he did, and let's say she told you, he did that thing I told you about a couple of weeks ago, but I don't know. And so then I might be curious, and I might say, well, tell me about your feelings about forgiving him. Like, what's that like for you? Well, I don't know, I'm confused. You're confused, okay. Sometimes I just feel like I'm being... So sometimes you feel like forgiving, at other times you don't. Tell me about the times that you really feel like forgiving. Help me understand that better. Now, Kelly, help me understand those times that you really don't feel. So by simply asking it that way, with curiosity, I'm creating texture. I'm not creating it. I'm giving space for her to create texture. And by simply asking it that way, it opens the door to things like, forgiveness can be something that I feel more or less forgiving at a certain point in time in my life, one that changes as life changes. It can be partial. I forgive this, but not that. It can be subjective. I struggle with it, but my sister feels this way, but I'm struggling with it. Oh, okay, that's interesting. You and your sister have a different perspective on this. And it frees them from pressure to forgive to choice to forgive. What else do we help them do? We help the client reduce their self-judgment about forgiveness. Listen for judgment about forgiveness. I really should. Listen to should words. The CBT folks, I'm primarily, as you can tell, psychodynamic, but there's a lot of cool little tidbits that I've gotten from CBT over the years. I love their interest in should statements. I think of them very much as a failure of internal curiosity. It's really a retreat toward obligation, toward a sense of role and responsibility when people say should. And it's exactly the same thing you hear a lot. I really should forgive my grandpa. What's wrong with me? Tell me about should. Notice. It's so interesting, Kelly, when you say you're angry at him, but you should forgive him. How do you understand that? Again, I don't know what she's going to do with that, but notice judgments about forgiveness. Help the client explore them, explore their meaning, explore their self-imposed pressure to forgive. So who exactly is pressuring you? Is your sister telling you you have to forgive? No. She's not telling me I have to forgive. No, no, my sister's great. Okay. So wait, then I'm confused, Kelly. If your sister's not telling you have to forgive, then who's telling you? I mean, I guess me? Like, I guess I feel like I have to forgive? Huh. Okay. Help me understand that. What goes into that? Help me understand that. Well, are you saying I don't have to forgive? I don't know. I mean, I didn't go through what you went through. I have no idea whether you should or shouldn't. But I'm curious about, what do you think's going on for you this week that you're feeling this feeling more now? You could have raised this 3 weeks ago. What's going on for you that you're feeling this now? So that's a mentalizing question. That's a self-reflection question. And it treats forgiveness just like anything else. The client who's feeling shame, what's going on for you that you're feeling shame now? That would be a very common question I would ask. Same kind of questions I would ask around forgiveness. Helping the client explore their self-imposed pressure to forgive. Helping the client explore contradictory feelings about the perpetrator. I should, well, my grandpa was blah, 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 but he was also blah, blah, blah. And he was like, he's a good guy. Yeah, that's confusing. Some of her best memories were going to a baseball game with her grandpa. She felt close to him and didn't feel close to very many other people. And yet, there's this other thing that happened. And so the story is complicated. And so you might feel like this is wrong that her grandpa sexually molested her. And you might be right. Maybe it is morally wrong. But for the client, it might be more complicated than that. It might be like, well, yeah, but he also took me to those baseball games and nobody else did. And so I don't know what to feel. And so if you really are keeping your countertransference in check, you're aware that, yeah, you can feel a lot of different things towards somebody all at the same time. And so you forgive this, but don't forgive that. You feel this, but also that. Like this, exactly the way we would with anything else in therapy. In this way, we shift away from forgiveness as virtue toward forgiveness as psychological process. Okay. Questions before we move on? I'm sure there are many. Yes?
Question, is the flip side something as well? In other words, there are times either internally or, let's say, systemically, where there's pressure to not forgive.
Yeah.
Right? In other words, like, I don't know, my sister is still so angry, and she's the oldest, and you have cases sometimes where the older sibling is going to bat for me like crazy.
Uh-huh.
Right? And feeling like part of me is feeling like I am ready to do some forgiveness.
But I would feel like I'm betraying my sister. Right.
Or sometimes betraying the safety. After years and years, sometimes it's scary to take a deep breath and move towards yes, act.
That's right. Absolutely. 100%. And that's where it would be really important to be aware of your countertransference. I think it's very easy. What's that?
Both ways. Right?
Both ways, because you as a therapist could feel contempt for the perpetrator, and that contempt can be really powerful and hold you back from giving space for the client to do something that they need to do. It's right, but yeah, absolutely. Yeah, great question. Yes, Aaron.
I thought I had also that, but appreciation that it's not black and white. There's room that can be done in the room before going towards the forgiveness.
Yeah.
Meaning you can start doing some steps in the room first.
Right.
Let's see that. And you share other forms of
Yeah.
finding space for yourself, but ultimately we have to see how that is, how that goes for you
Right.
before moving to the next that other phase.
Nice. Well, like, what does that feel for you? How does that sit with you? Yeah, expressing different feelings. Yeah, and an empty chair is a great technique for that. Yeah, exactly. Nice. Yeah.
I do appreciate this creating space around it. That
Okay.
created the cultural issue involved, which I mainly work with non-Jews.
Okay.
And often people will come in, I've already forgiven my perpetrator. And
Yeah.
I talk about just trying to create space around the option of
Yeah.
not forgiving. So I talk about premature forgiveness.
Okay.
Because I think for Christians, it's hard for us as Jews, I think, to understand. If you are not Christ-like, if you are not forgiving, you are the problem.
Right.
Which means that for them to even, so as a Jew, I'm coming in saying, no, let's create space around degrees of forgiveness.
Yeah.
It's almost going against their religion.
Yeah.
And it has to be handled with a lot of sensitivity if you're working with a Christian.
Yeah.
Because you don't want to make them feel bad for being the bad. And so sometimes
Yeah.
I recommend people watch a thing called Women Talking, where there's a trailer to that.
Yeah.
Who are we? You know, that pressure to forgive. And the
Yeah.
issue of self-forgiveness.
Yeah. Oh, we'll get there if we have time. If we have time. But let me. So, but let.
Not about even self-judgment about forgiveness.
Yeah.
But self-judgment about what they may have done in the situation.
Yeah.
To not forgive themselves.
Yeah.
That's
Yes.
more emphasis on that.
I'll get. Hopefully, I'll get there if we have time to. Let me say this. I also work with a number of my clients. I have Jewish clients. I have Israeli clients. I have clients who are religious Christians, clients who are religious Muslims. Toronto is a very, very multi-ethnic city. We had large waves of immigration over the last few decades. So, and I agree with you. It's a real challenge. As someone who's Jewish, I do talk about in Chapter 5 of Trauma and the Struggle to Open Up, a client where the metaphor of Shiva, and in this case it was sitting Shiva for her dog, which may seem like a funny kind of idea, but it was actually exactly what she needed. And she wasn't Jewish, but I did share something with her from my culture, and sort of, now this is not something I typically do. This is an unusual thing, but I did. And in her own way, finding space to do that was actually helpful. But it was something about her and her interest in that sort of thing that led me to do that. With other clients, I have clients who have been told by their priest, go back to your abusive husband because divorce is a sin. And then others who have been told by their priest or minister, no, of course not. I mean, God would not want you to such and such, and absolutely no. There are reasons, you know, your life is more important, and this is dangerous, and of course you would be forgiven if you had a divorce, and they're Catholic as well. So there's diversity within all the communities, and you get different people with different kinds of issues and hang-ups and emotional connections to different religious and in different kinds of churches, and the subjectivity is so important, is what does it mean to this particular person, and how do I work with that person around the metaphors that matter to them. But I think regardless, you can think of forgiveness as a process for them at the pace that they can bear. And so, yes, it's true that they may feel like, no, this is not right from my religion. On the other hand, I would say, how interesting that they found a Jewish therapist. I mean, they could have found a Catholic therapist who would have told them the exact, from a kind of church that would have told them exactly what, that they shouldn't be, and instead they found someone from outside their religion. And so you'd wonder what part of them is seeking a more textured approach to their own past. Why would they need to find somebody who's so far from their community what would feel relieving to them about being with someone outside their community? Is it in fact the case that your very different perspective may be exactly what they need? In part, even as part might be, in part they may struggle with it, would be something I would wonder about. One more question and then we'll continue. Yeah, yeah.
Sometimes, or oftentimes, there's abuse in a case where there was problems in the household, and the abuser is actually in some way a savior, where they're saving this kid out, they're taking them out to baseball, and etc.
Yeah.
So that could put it in context for us that we have to kind of
Exactly.
do things at the same time.
Exactly.
The fact that they still feel that this perpetrator saved them.
And they could have very mixed feelings. Okay, let's take a look. So here, mixed feelings, which I feel like we've probably already covered. All right, I'm going to move forward there. So what about the, let me see, because I want to get to forgiving themselves. I want to make sure self-forgiveness, that we have enough time and we're a bit limited. So let me just, let's see. You know what, let's move toward, let's talk about self-forgiveness. Thank you for raising it. I want to make sure I have enough time. Okay, so self-forgiveness is a really important issue, and similarly, I suggest giving space for thinking about forgiveness as a process. What are some of the situations that people really struggle with in trauma around self-forgiveness? Well, very often there are feelings of shame. In the example that I gave of the grandfather, it's not unusual for people who've been through sexual abuse to experience some physiological arousal when they were sexually abused. There's a book called Push, so there was a film, Precious, and it's about a black woman who grew up, I think in New York City, and terrible abuse. Now, it's a tough book to read. It's a beautiful book to read in terms of its poetry, the poetry of the writing, but it is a tough book to read because there's a lot of stuff in there that, high trigger warnings, I would say. But it's a really beautiful book in its own kind of sad and painful way. But one thing that it does a beautiful job of, among many other things, is really illustrating the incredibly uncomfortable feelings of sexual arousal that some sexual abuse survivors have. Even when that sexual abuse was perpetrated, well, regardless of who it was perpetrated by, whether it was perpetrated by a partner or whether it was perpetrated by a caregiver, a parent, or a family member, that there is and so the author, Ramona Lofton, does a very nice job of illustrating the physiological reactions that people, that in this case the character, can have, and the feeling of shame as a result of that, the feeling of self-loathing that comes up. Why do I feel this way? But then having these sexual fantasies and feelings as a result of the sexual abuse. Now, of course, one of the things that in trauma work and trauma-informed therapy that we do, part of the work is psychoeducation. And again, although I primarily work in an integrative, psychodynamic kind of way, there are certain things that are very helpful from some other modalities. And psychoeducation can be really helpful for many trauma survivors. I don't spend hours lecturing at people, but I might throw in a little bit of a tidbit here and there. A lot of survivors of sexual abuse say that sometimes they have these sexual feelings that they're really uncomfortable and had sexual feelings when they were sexually abused. That's a physiological reaction, and it's normal. And it doesn't make you a bad person, or, in your words, as you mentioned a moment ago, a pervert, or any of that. It just makes you a human being. It's part of what happens when people, even children, are sexually stimulated. Doesn't matter by who. It can be by a caregiver. It can be by anybody. They sometimes have sexual feelings. And that's just part of being a human. Now, I might say that to somebody. I might. That might be a psychoeducational part of what we want people to understand is, this is quite a normal thing. How you do that and whether you do that in this context or that context, I would leave to you. But I will just say that some kind of awareness of that is really important. Clients also feel shame for and have trouble forgiving themselves for affection they might feel toward the perpetrator. As I mentioned, he'd hug me when sexually abusing me. And you know what, Dr. Muller? Nobody else hugged me. So is he such a bad guy? Right, try answering that question, right? Right? So it's tough. Well, okay. Part of the person feels this, but part of the person feels that. And it's a complicated thing, but I do a lot of work with parts of self. And I will say, yeah, I hear you, Beth. Sometimes when he would sexually abuse you, you felt a real feeling of closeness. Help me understand that feeling of closeness. That's a hard thing to explore, because you might feel that you're now justifying the abuse, or, how do we do that without you saying that somehow this person is rendered blameless? Not easy. Okay.
Sexual abuse is like a con job. It's not done in a violent way. It's done in a gentle, often playful. But the person who's doing it is trying to con the victim into allowing it to happen.
Yeah.
And that's, I'd say, a high percentage of sexual abuse cases. I use the word it's con, the person is conned. So they actually play upon the feelings of that child.
Yeah.
So how do you help somebody understand that they were conned and it's not authentic?
Let's keep going.
I'm not answering that, I'm just saying that's what
Yeah, exactly. Let's keep going. So clients will, and I will share some of the what to do piece around this in a moment, but let me move forward just in the interest of time. Clients might also feel shame for the choices they made. I didn't fight back. I didn't protect others. Let's take a look for a moment at this client and his experience. I gave him the adult attachment interview, which I talked a little bit about this morning. But in this, at this moment in this developmental interview, I asked him, tell me, let's call him Joe. Joe, did you ever feel rejected as a child? And pay attention to his feeling of choices he made around this trauma story he tells, and how he might feel about himself and what he might be struggling with. By the way, this is actual clinical material. However, the person that you will see and hear is an actor. Okay, but this is actually based on an actual clinical case. I just de-identified it to protect the client's identity. So I asked him, tell me, Joe, were you ever rejected as a child? And this is
Did I ever feel rejected as a child? Well, I kind of feel bad for saying this, but I guess so. I mean, not that my mom did it on purpose. She got sort of depressed after our dad died. We all did a bit, I think. She hardly spoke any English and couldn't find work. The construction company my dad was working for refused to pay out his pension. I remember one time my sister was in the washroom, and my sister, I guess she got her period. She was younger than me, and I kind of felt responsible for her. But I would have felt dumb going into the washroom to help her. I was 14, so it would have been weird. So I knocked on my mom's bedroom door for help, and she was drunk again, and she did nothing, no help. Told me to go figure it out myself, and she just stayed in her room. She did nothing. My sister was crying. She was scared. She didn't know what was going on. I guess as I think about it now, I did feel rejected and hurt. It's true. As if we just didn't matter all that much. And I felt bad for my sister. She was just so scared and everything. I couldn't help her. I mean, I've done okay, but she's still got tons of problems. So, there you go. Woo! I wasn't expecting to tell you about all that.
Okay, so let's unpack that a bit. What are some of your thoughts around the issue of self-forgiveness regarding this particular client, regarding Joe? Where do you think he might struggle with that? Yeah. Yeah. Yeah.
So, on the one hand, he's kind of feeling rejected at his mom and angry at his mom.
Right.
But also feeling really bad.
Mm-hmm. Good. Yeah. Okay. Yeah.
Him, his role with his sister.
Uh-huh.
Not only, the awkwardness of I couldn't go in, but then he threw in at the end, that I ended up all right. And the ambivalence. I guess I did what I could.
Mm-hmm.
She's still got a lot of problems.
She's still got problems. And yeah. And what, some thoughts about parts of self. What might be, what might be as yet unintegrated, or what might he still have to kind of contend with? Yeah. 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 Good. Right, exactly. Two tough choices. What do I do? Did I do the right thing? A sense of guilt about it, a sense of maybe shame. I'm a bad brother, I'm a bad person, I'm, maybe just guilt, I don't know, but regardless, there are feelings there, right? And there's something that's really unresolved. Yeah.
To look at it from a more somatic perspective,
Yeah.
this unfinished, he couldn't go in and help his sister.
Yeah.
He couldn't do anything with his
Yes.
mother. So there's all this unfinished stuff inside his
Exactly.
body that didn't get resolved. So the
Yeah.
resolution in whichever direction you want to look at it.
Exactly. We would say there's unfinished business, and I agree with you. You can see that it may be, really kind of right in there, and in terms of physical. In fact, he came in, to your point, this person came into therapy because he was having trouble sexually. He was a young man who had a girlfriend of several, like about 7 or 8 months, and his girlfriend wanted to have sex, and he really struggled with it. I mean, for him, and what he struggled with was this sort of being willing to be vulnerable enough and, in his words, selfish enough to find her arousing and not constantly doing something for her. There was this feeling, this was someone who had this profile that John Bowlby talked about, the compulsive caregiver, the person who has trouble with vulnerable feelings because their modus operandi is to do for others. I have to fix this, I have to do that, I have to help others. And so some of the work was around being willing to let himself enjoy something, to be able to be in the moment, to be able to allow himself, and it was not easy. There was a feeling of, if I do that, I'm selfish, right? So
now I'm doing it
to try to repair. Yeah, good, okay. So we have a good sense here of how we're seeing this. So what do we do with clients who struggle with self-forgiveness? And well, part of what we do is we help the client by helping them integrate parts of self. The reality is that part of the human experience, and this is where, and I mentioned this morning, some of the work, I mentioned it here too, if you're doing good trauma work around loss, mourning, helping people unpack, process their trauma, you're also going to have a situation where some existential questions will come up. Like I mentioned before, why me? Why not me? Those kinds of existential. What kind of God would let this happen in this world is a question I have clients who ask me, and I have no answer for them. But I say it's a really good question, and we think about it together. Even though we don't come up with any answers, we think about it together. And simply doing that, asking the question and giving space, gives space for different parts of self to express. And in that process, in that exploration, we come to a place where we all have parts we're not proud of. We all have parts that if we could, we all have stories. Every single one of us has a story where we look back and think, if I could amputate that story from my life, I think I would. I would really like to just go in there with a knife and just cut that story right out of my history. But here we are. We can't do that. And that's part of, as Yalom talked about, part of the human condition is that we have these stories that we live with, that we feel shame for, and nobody leaves this world without a something. And we all have a thing. We all have a thing. We can't amputate those stories. We can't pretend they don't exist. When clients are highly judgmental of themselves, I say to them, Tony, you sound like you're yelling at yourself. And he says, well, I think it's wrong that okay, I hear you. I hear that you don't like it, that you do X, Y, Z. And you can judge yourself. I'm not telling you what to do here. The only problem with judging is the story ends. You're a bad person. We can't do anything with that. And in addition to judging yourself as a horrible human being in your own words from a moment ago, I'm wondering if we can also be curious and wonder what was going on for you when, or what is it that scared you and led you to ... and what is it that you wish you could change that you haven't been able to change, but you're suffering with. And by the way, we all suffer with something. Welcome to the human race, but we all suffer with something. It's hard. It's hard. I might say to people, helping people learn to sit with their parts. It's not just their past, it's actually their own parts. Yeah, but Dr. Muller, you don't understand. You don't understand. And I say, okay, Tony, help me understand. Okay, you don't get it. Okay, help me get it. Help me. Okay, when my grandpa started abusing my sister, do you understand that I ran out of the house? I literally left her there. And I say, yeah, you did. I just really struggle with that. And I say to him, yeah, that's really hard. That is really hard. That is something that you are living with, that is sad and painful, and you wish you could change it and wish you could make it go away. But don't you think I'm a terrible person? No. Why would I think that? Well, I ran out of the house when my grandpa was abusing my sister. Yeah? So you don't think I'm a terrible person? No, not really. No. You're so weird, Dr. Muller. I get that a lot. I'm weird. Yeah, I don't try to talk them out of their feelings, but sitting with those parts and examining the meaning in a, honestly, in an Irwin Yalom kind of way. Irwin Yalom's classic books are still so instructive around loss and around the human condition. That's kind of what you need to do there. Will it lead to self-forgiveness? I don't know. Maybe. What I do hope is that it will at least lead the person to begin to bear these parts of themselves. And bearing, living with yourself, actually bearing that this was something you did, and you're not doomed to have a horrible life, is a really important piece of the work. And clients ask me often, well, what happens at the end of therapy? Do I all of a sudden, what happens? And I say, well, here's what other clients I've worked with have said to me, where they've reached the end of, they feel, their therapy. They still have a trauma story. The trauma story can't go away. But what we think about is that this trauma story is a chapter in your life. And it's a chapter, it's a book, your life. And like in any good book, each chapter affects later chapters. You can't expect to take that trauma story away or to get rid of the chapter. That chapter affected all the other chapters. And it's just one chapter. So what the rest of your life looks like as you write that book, I don't know. I mean, that's something that you and I can think about. And that's what I usually say to clients. So do they forgive themselves or not? I don't know. It's not something I'm necessarily gunning for, but there are some clients, many clients who I've worked with where they've reached that point, and I've have other clients who know, not necessarily reaching that point, but can they live with their trauma? Can they bear the feelings that go along with it? Much better at the end of therapy. And did they have a chance to mourn their losses? Absolutely. That's what I go for in therapy. Okay. Before we end for today, I was told I have only a couple minutes left, but I do want to have some time for questions. I want to let you know I have an online magazine, the Trauma and Mental Health Report. Just Google it. It's free. Short articles about trauma and mental health that you can share with your clients and you can share with your supervisees, or that you can read. This is just one example. Breaking the Cycle, Maternal Substance Abuse, 2-page article, written in plain English, so like a grade 10 or something, reading level. So it's very, very readable, and it really informs people about trauma. The project is as we write there, sharing knowledge on trauma and mental health with the community. These are my books, Trauma and the Struggle to Open Up, so you have that in your handout, and Trauma and the Avoidant Client. All right, questions in the last 2 minutes that we have. Yes, I know you had your hand up before and you didn't have a chance.
Do you feel that a person needs to express anger in some form before they forgive the person?
I mean, if someone has trouble expressing emotions that one would expect to be there in a certain situation, I'm wondering, where is that emotion? Like, where has it been exiled to? And so I would be really curious, and I would think, yeah, something's going on. Let's stop. Like, it's curious that and often these feelings that are repressed are expressed with ambivalence. So there might be like, it's so interesting, Kyle, you're furious at your best friend for being a lousy dad, according to what you said to me a couple weeks ago, but now you're saying that your dad did nothing wrong, even though if I'm correctly understanding, he did exactly what your friend's dad did that you just told me about a few minutes ago. I'm confused. Now, like that just might be a simple kind of, and I might challenge the person, and I don't know where that would go, but I will be curious. I wouldn't use that as a manipulative technique. I would say that if I really was confused, if I really was like, well, hang on a second, we're hearing different things here. What does this mean to you? Are we talking about different parts of you at different times? I might say. Well, what do you mean by parts? Well, let's say I've done some parts work with them. Well, like we talked about, Kyle, part of you sometimes feels this way, part of you sometimes feels that way. Is that what we're seeing here, where you're, in this versus in that, that kind of thing. So I do use parts work a lot in trauma work because I find it very helpful. And I find that you can do a lot of this process work using parts metaphor. I don't tend to adhere super strictly to IFS, but I do, I'm integrative and primarily psychodynamic, and I will draw on the parts metaphor because I find people use it well very often in the work. I think you had your hand up, or somebody else had their hand up, or you're sort of half have your hand up. Okay, yeah.
Yeah. So we've spoke a lot about forgiveness and forgiveness as a psychological process.
Yes.
But we haven't named it's a psychological process of what? Because I think forgiveness is very subjective, and I'm wondering if before we go there with the client in terms of opening it up, it sounds like it's important to define for the client what exactly they mean.
Or I would say that's a fantastic question. Like, where are you going with this? You're raising, or we're raising. Where are we going with this? What are you hoping? I mentioned this morning, I very often will say, if we were to, what do you hope? What do you fear? Those kinds of questions. Hope, fear. I often ask, what are you hoping? Where are you hoping you would be able to, and what do you worry would happen if? And so that would be exactly the kind of question I would ask if it feels in some sense nebulous. In order to what? Like what do we imagine will happen at the end of
Especially because I would imagine on the perpetrator side, often, will you forgive me basically means, will you just act normal so that we can never
Exactly.
which is not necessarily what forgiveness might mean in another context.
Exactly. 100%. Exactly. Very nicely said. Yeah.
Can I ask, Herman's model, the three phases, my understanding is that she added that fourth phase of justice.
Right. Yes. In her most recent book.
Right, and to me it's a little bit confusing. Because I'm again, I don't have her stature, so I'm not correct. But a lot of clients, I don't know, like you had said, a lot of people don't need that level.
Yeah.
One of the things that makes me somewhat fearful, I guess, is the counter side of it all. This is sometimes you'll have an advocate who will kind of, express like there's no way you can heal it unless you go for unless you report or unless you get justice.
So let me just say that I really loved Trauma and Recovery, 1993. Her most recent book, that's a couple years old, I struggle with. And I think that it comes from kind of really being very much involved in the social justice community. I have nothing against, I'm all for social justice, that's fine, things should be just, that's great. But I think in terms of psychotherapy, I think when we get too far into any ideology, whatever that is, I struggle with clients who, anyway, there are lots of ideologies there's so many ideologies. Yeah, it can run the risk of imposing the therapist's wishes onto the client and not really exploring what the client needs to. So if it's a client for whom justice is important, great. That's what we talk about. But if it's not, absolutely not something. Yeah, like whose agenda is it? Yeah, I'm sort of not in favor of agenda-based therapy. I think so. At the end of the day, what's that?
It's hard enough to do the work as therapists, let alone
trying to get the yeah, okay. Let's stop there, folks. Thank you so much. You're very welcome. Yeah, have a nice day. I'll be here for any questions.
That was really wonderful. I so enjoyed
Oh, good,
it.
good, good.
It's great. Janice A. Spring has the safety here, and the title is How Can I Forgive You? Courage to Forgive is Courageous Not to.